All right. Good afternoon, everyone. This is Committee Member Anderson of the Public Health and Pharmacy Formulary Advisory Committee, and I now call this special meeting to order. Today is Monday, March 4th, 2024, and it is 1:01 p.m. Public Health and Pharmacy Formulary Advisory Committee meetings are conducted in accordance with the Oregon Public Meetings Law. Under the Public Meetings Law, governing body meetings are open to the public except as otherwise provided by law. The presiding officer has the authority to keep order and to impose any reasonable restrictions necessary for the efficient and orderly conduct of a meeting. Governing bodies are authorized by ORS 192.660 to meet in, quote, closed or executive, end quote, session in certain limited situations. All official actions by the committee must be taken by public vote, and the vote of each member must be recorded. We will now take roll call. So for the record, when I call your name, please verbally acknowledge here. I'm Committee Member Anderson, and I am here. Committee Member Andrew Gibler.
Here.
Committee Member Catherine Hammond.
Here.
Committee Member Sean Jones.
Here.
Committee Member Alicia Lee.
Here.
Committee Member Mark Myers.
Here.
Committee Member Sarah Wickenhagen.
Here.
Staff Member Jennifer Davis.
Here.
Staff Member Brianna Efremoff.
Here.
Executive Director Jamal T. Fox.
Here.
And Staff Member Rachel Melvin.
Here.
Great. I am going to now review some housekeeping and meeting etiquette for committee members and staff. Please silence all devices. Identify yourself as committee or staff member with your last name each time you speak. Please speak clearly and one at a time, as it is critical for the public record. Please note that this meeting is being recorded and retained as a public record. We will now review the meeting agenda. And I believe everybody has been sent that agenda. Do I have a motion to move and to approve the meeting agenda?
Motion to approve.
Great. Is there a second?
Second.
That was Committee Member Kibler.
Committee Member Wickenhagen, second.
Great. I'm going to go through the roll call, and please say yes if you approve, or oppose, or recuse, or abstain. Committee Member Anderson, yes. Committee Member Gibler.
Aye.
Committee Member Hammond.
Yes.
Committee Member Jones.
Yes.
Committee Member Lee.
Yes.
Committee Member Myers.
Yes.
And Committee Member Wickenhagen.
Yes.
Great. This motion passes. All right. We will now review and discuss the mailing of a coronavirus 19 with Staff Member Davis and SME Crystal Sharp.
Join the call.
Staff Member Davis, before we get started, can we just have our two SMEs introduce themselves real quickly, starting with Crystal?
Hi, everyone. My name is Crystal Sharp. I'm a community pharmacist with Fred Meyer, here to talk about COVID today.
And Assad.
Hi, good afternoon. Assad Abaidi. I'm an Oregon pharmacist currently working in the hepatitis B space. But I've been doing adult immunizations for about 10 plus years.
All right, take it away, Crystal.
All right. And I just wanted to start out by saying I apologize. I'm doing this on my phone. So if you see a close up of my face, I apologize. Anyways, let's get started. So as a lot of you probably heard last week, ACIP met and approved a new recommendation for COVID-19 for individuals 65 years and older. And that recommendation was that they should receive an additional dose of the 2023-2024 COVID-19 vaccine. And it has to be at least 4 months after the receipt of a previous 2023-2024 dose. So that is reflected in what's new.
Staff Member Davis, I do just want to point out where there's highlights, like under B, That's where the committee, when you met last time, you made changes to that. So I didn't want you to see both sets of changes in the same document. I thought that would get confusing. So what you see in track changes is only what is new since you approved the protocol at our last meeting.
Section 1, parent C, there was just a small typo. So it read Moderna of Pfizer. That should be Moderna or Pfizer. So that was updated. Section 2, immunization protocol. So an organ pharmacist should administer 1 or more doses of the updated 2023-2024 Moderna, Novavax, or Pfizer COVID-19 vaccine according to ACIP recommendations and package insert. So if they're eligible for a second dose, if they're 65 years or older, they'll get more than 1. If they're below 65, they're still only, well, depending on their age, they could be indicated for 1 or more. And then some feedback that the committee provided at our last meeting was removing the dashes when we're talking about age. So we did our best to incorporate that feedback for this round. So you'll see that change throughout the document. And then where we really started making changes was section 3, parent B. So this previously was any immunocompetent person 12 years or older was indicated for 1 dose of mRNA or who was previously vaccinated. They can receive at least 1 dose of Novavax to be considered current. But since we have this new category of 65 and older who can get an additional dose, we changed that to 12 through 64 years of age. And then our main chunk here where we incorporated the new update was any immunocompetent person, 65 years of age, regardless of vaccination status, is up to date if they have completed one of the following options. So they'll be considered up to date if they've received at least 2 doses of updated mRNA. So that would be the Pfizer or Moderna 2023-2024 COVID-19 vaccine. Or they could have received a combination of 1 dose of mRNA, followed by 1 dose of adjuvanted Novavax COVID-19 vaccine, because this recommendation that they just came out with can be either of the 3 formulations. Alternatively, any immunocompetent person 65 years of age who is previously vaccinated, so that's defined below, is up to date if they have completed one of the following. So if they've received at least 2 doses of adjuvanted Novavax 2023-2024, or received a 2-dose combo series consisting of adjuvanted Novavax vaccine followed by 1 dose of mRNA COVID vaccine. And then as we continue on, any previously unvaccinated person that comes in wanting to get vaccinated, that's 65 years of age or older, will be considered up to date if they have either received 2 doses of adjuvanted Novavax followed by 1 dose of mRNA, or if they've received 3 doses of adjuvanted Novavax COVID-19 vaccine. So right here might be a good place to pause, because I know that was a lot of information, to see if anyone has any questions or any feedback on wording. And I think obviously this change came about really quickly. So I know that next time this protocol is reviewed, we might explore some table or something a little bit easier to follow, but just given the lack of time and the urgency around this, this is what we developed. Okay, well, if no one has any comments, I'll just keep going. So you'll see some updates, section D, just removing a dash, doing through, and then section E. So this is any immunocompetent unvaccinated person 12 through 64 years of age. So that's an update, can be brought up to date with a single dose of mRNA or a 2-dose series of Novavax. That really has not changed. And then section F. So this is our new section. Any immunocompetent unvaccinated person, 65 years of age, may be brought up to date with one of the following. And again, this is essentially a rewording of what we just discussed, but we felt it was important to follow what we had already produced in this protocol. So we do have a section to bring folks up to date. So they can be brought up to date with 2 doses of updated mRNA 2023-2024 COVID-19 vaccine, 2-dose combo series consisting of 1 dose of mRNA followed by 1 dose of updated adjuvanted Novavax. They can receive a 2-dose series of updated adjuvanted Novavax followed by 1 dose of updated mRNA, or they have the option of doing the 3-dose series of updated adjuvanted Novavax. So I know that's a lot, and as you can imagine, writing this, we were trying to keep it as clear as possible, but I think given there's so many different options of how they can become up to date, there was a little bit of a struggle there. Any questions or concerns regarding that section?
Crystal, Staff Member Davis, I just want to make sure we got the lead-ins correct. I got a question from someone who was reviewing it. So just making sure, parenthesis, any immunocompetent person over 65, regardless of vaccine. And then the next section is any immunocompetent person over 65 who is previously vaccinated, which could be the same thing as regardless of vaccination status.
I think that if we change that wording to anyone who's previously vaccinated prior to the 2023-2024 season might provide a little bit more clarity.
Yeah, I just know you had a comment over here, so I wanted to make sure that it's clear to the committee members, because I don't want to get to the board meeting in 15 minutes and then there be questions. So the next section is any previously unvaccinated person over 65, and this is talking about is up to date if they've completed. And then we're kind of changing our nomenclature again. I just wanted to make sure we're clear. So is your recommendation on C to change that language?
Yes, I mean, we do technically have previously vaccinated at the very bottom of the section
Okay.
at under G, but I do think either we can move that small blurb up to right after the end of C, or we, which would actually be preferred if we can do that. And then I think that solves our problem.
It clarifies the confusion. Of course, I'm not seeing it paste, so hold on just a second. Where is it pasting this? Give me just a second. I'm like, I want it here. Okay, there we go.
This is Committee Member Jones. And I think Jen's point is important because I think there's a lot of wording that is essentially saying the same thing. And then you're just trying to look and find what's different about this. And if some of that's, could just be dropped, I think it would be clear that regardless of vaccination status, seems to summarize everything we need to know.
So the key distinction, though, is that if someone, so for Novavax, it's a little bit different. If they have not been previously vaccinated with any vaccine, they do need that 3-dose series. And technically, they're considered to be up to date for the season if they were previously vaccinated and then they get that 2-dose series of Novavax. Does that make sense?
Yeah, I guess that first, well, let's see. I mean, could you add the 3-dose to that C section as a C3 or something of the regardless of vaccination status?
So vaccination status does matter though, because if they were previously vaccinated, they would only be indicated for 2 doses. If they were not previously vaccinated, they're indicated for 3 doses. So that's why we're trying to break it
All
up.
right. Yeah. A lot of words. But
It's
yeah, I
important
see
to have
that.
this conversation on the record in case there's any questions, so.
And to Crystal's point, I think in future iterations, if we can somehow get this on a table, I think that is going to help clarify.
Okay, Crystal, is there anything else other than just kind of these 3 through like the age range changes? Is there anything else in the protocol?
There is one thing, if you can scroll down a little. Yes, so right here, we have updated this table. So the Pfizer community, just to illustrate that there is a second dose available for 65 years and up, and there has to be at least 4 months since their last 2023-2024 COVID-19 vaccine. And then same
Moderna.
same concept for Moderna. And then for Novavax, we've added that 3rd dose that could be indicated for 65 years and up, since they can get that additional dose. And again, 4 months after their last 2023-2024 dose. And then, so that first table was for unvaccinated persons. So again, if someone comes to us, it's probably not very common anymore, but if they were unvaccinated, they would be eligible for 3 doses. Now, if someone's received any COVID-19 vaccine prior to the season, they are considered to be previously vaccinated, and then they would only be indicated for 2 doses of Novavax if they're 65 years and up, and only 1 dose if under 65, with the caveat of being previously vaccinated prior to the season. So as you can see, there's a lot of ifs and flows to see, you know, there's a lot of things that need to be met to determine what one they can get. And then we just have another blurb, recommendations for use. Person 65 years and old should receive an additional dose of 2023-2024 vaccine at least 4 months after receipt of their most previous dose. And then section 9, we had noticed that there was a small note that had been omitted. We're not sure where that fell off, but just adding a definition or a caveat of for lymph node swelling, that's more common after the booster than initial series. And then after that, we added basically what we could find that is currently published, basically just their ACIP announcement of this update, and that's it.
Great. Questions from the committee?
I have no. Go ahead, Myers.
Committee Member Jones, I don't know if you saw what I said in about the cardiac side effects.
You need to bring that up here in this forum if you have a concern.
I'm sorry?
You need to say what your concern is.
Yeah, okay.
Yeah.
Under contraindications, this isn't a contraindication, but it's a relative contraindication that the CDC has guidance about prior myocarditis or pericarditis associated with the vaccine. It's recognized as a rare but true corollary, and it would be a relative contraindication to giving a second dose of the vaccine. So I wonder if that should be included.
Staff Member Davis, I did go and just look because I know that these protocols were modeled off of OHA's protocol that we had previously. And OHA's protocol doesn't address that as being a contraindication other than to say extending the dose, the time between dose 1 and 2. Subject matter expert Sharp, do you have anything to add about why that wasn't included in the protocol?
No, you make a good point of it needing to be a consultation point. I think just adding it to the protocol in general is important, not necessarily for the most recent update that we got, because usually I know we were seeing higher levels of myocarditis in younger males, so not necessarily specific for 65 and up. But I think that we could take some of that language from the CDC that staff member Davis was referring to and possibly make a point D under precautions, just talking about extending the spacing between the 2 doses for that specific age range.
So I pulled up I prepped enough to pull up the CDC's website about this particular issue. And so they have different language. Development of myocarditis or pericarditis within 3 weeks after a dose is a precaution to a subsequent dose. And subsequent doses should generally be avoided, generally not receive a subsequent dose, or if after an assessment to receive a dose and then to space it. What language do you want me to pull in, Dr. Jones?
Well, this is Committee Member Jones. I would also point out, just to clarify, that there is no discussion about age in that section. So yes, it's most common in young males, but it can occur at any age. So I think it has to be a counseling point for everybody.
Should it be this people, especially males ages 12 to 39 years, should be made aware of the risk that I have highlighted?
You know, the tricky thing is, I don't know when the CDC acknowledged that this was a true association. I have no idea when so I don't know, you know, it is some of that prior guidance before that point was clarified.
Senator Davis,
Seems like
I did go
anybody
back.
should be cautioned about that.
I did go back to look for this information, and there was some preliminary data that was provided back in the fall at the ACIP meeting that the cardiac issues with the updated bivalent vaccine, not the 2023-2024 formulation we're using now, but that the what's the proper word, the flag had been much reduced, and that it was much less of a concern with the bivalent, but we didn't have data yet on the 2023-2024 formulation.
I mean, the other reason, I don't know, maybe other people have more experience with administering these vaccines, is it being brought up by the public more commonly? And so therefore just having that guidance in there to address patient questions. The other reason that it would be useful to have it. It seems like the relative contraindication should be in that following the absolute contraindication section, and then the counseling, you know, there's very rare side effects. I'm not sure where to put that, but I think because it's kind of increasingly in the public consciousness, it should be included in the counseling, probably for everybody.
What did this committee member give? What is the absolute risk for myocarditis? It's 1 in a million, it's pretty low. I just don't, I'm not used to counseling routinely for things that occur in such a rare
yeah, I'm not sure that's as critical as it is to just be in there, and the precautions of not immediately giving a follow-up dose if they have had a reaction before.
Yeah, I agree with that.
Yeah, and the risk, this was according to the 2022 vaccines, especially for 65, it was, you know, the rates were similar to baseline. for adults over 65, but the major risk was for the younger, 18, 24, 18 to 30 range. But for this age, for the 65 plus, it was like 6.5 per million doses administered. So it was pretty low.
So do I have consensus from the committee to add anything into this protocol about myocarditis and pericarditis? Could do a quick roll
So I
call.
think, this is Committee Member Gibler, I think a precaution that anyone with a previous history of that needs to be a conversation between the pharmacist and that individual about the risks and benefits. And I'm sure it's already been done with their physician, but still, it needs to be, another conversation needs to take place. And that's just my opinion, but I agree with Dr. Jones on that.
I'm trying to, people have a history of myocarditis or pericarditis that occurred before COVID vaccination or more than 3 weeks after a COVID-19 vaccine dose should be made aware of the risk of myocarditis and pericarditis following receipt of these vaccines and the benefit of vaccine and reducing the risk of severe outcomes from COVID-19.
Well, that's a weird one because Committee Member Jones, because that's counseling that they probably are low risk of having that reaction, that a prior episode of myocarditis or pericarditis that's unconnected to the vaccine shouldn't preclude getting the vaccine in the future. That's what that section is saying. And I think the main thing we agreed on was that that there needs to be the relative contraindication if they've had a vaccine-associated cardiac issue, that they be counseled about the risks of getting any further vaccination.
Right, yeah.
Can someone give me exact language so I can put this in here? I'm struggling to.
Yes.
People who have a history of myocarditis or pericarditis associated with a previous COVID-19 vaccination should be made aware of the rare risk, et cetera. Something to that effect.
Okay.
This Committee Member Anderson, Jen, on the website you were at, if you scroll down a little bit, because you were looking at like the considerations. Yeah, there it is, right there. I think that's what we were considering a little bit more. So, people that have a history of myocarditis or pericarditis that occurred after, I think it's a little further. Oh, wait, no, I'm sorry. Above that. There we go. So development of myocarditis within 3 weeks of a dose should avoid subsequent doses or should not receive a subsequent dose of any COVID-19 vaccine. Yeah, there you go.
Yeah, that's a stronger caution, I think, than what we were discussing earlier.
Agreed, yeah.
Sorry.
I'm so sorry. This is Staff Member Melvin. We are convening our board. They were convening at 1:30 to adopt this. Obviously, we're running a little bit behind. I just wanted to let you know. Yeah, probably about 5 minutes so we can consider a motion, and we still need to adjourn once you guys agree on this.
Just Committee Member Myers, do you need me for a quorum?
No.
We do not, because Committee Member Gibler joined. Thank you so much, Dr. Myers, for joining. We appreciate it.
Thank you. Sorry, I've got patients waiting.
No problem. Thank you.
Uh-huh.
So for those on the public call, it now reads development of myocarditis or pericarditis within 3 weeks after a dose of any COVID-19 vaccine as a precaution to a subsequent dose of COVID-19 vaccine, and subsequent doses should generally be avoided.
That looks good.
Okay,
Okay, back to
any other comments? That was one. Any other comments or concerns? Okay, back to you, Committee Chair Anderson.
All right, this is Committee Member Anderson. Do I have a motion to move to recommend proposed amendments to the coronavirus 19 statewide drug therapy management protocols version 3 of 2024 as revised today to the Oregon Board of Pharmacy for review?
This is Committee Member Wickenhagen. I will motion that. This
Thank
is
you.
Committee Member Hammond. I will second that.
Great. Thank you so much. I will go through the roll call. If you approve, say yes, opposed, or if you don't, say opposed, or if you want to recuse or abstain, mention that. So this is Committee Member Anderson. I approve, yes. Committee Member Gibler,
Yes.
Committee Member Hammond,
Yes.
Committee Member Jones just hopped off. Is that correct?
Yes, no, I'm here.
Oh,
Oh,
sorry.
no, Committee Member Myers is absent now.
Oh, yes, sorry. Committee Member Jones,
Yes.
Committee Member Lee,
Yes.
and Committee Member Myers just jumped off, and then Committee Member Wickenhagen.
Yes.
All right, this motion passes. Do I now have a motion to move to adjourn the meeting at 1:33 p.m.?
A motion to adjourn. Committee Member Jones.
Do I have a second?
Remember Gibler seconds.
Perfect. So this Committee Member Anderson, I approve, yes. Committee Member Gibler,
Yes.
Committee Member Hammond,
Yes.
Committee Member Jones,
Yes.
Committee Member Lee,
Yes.
and Committee Member Wickenhagen.
Yes.
Great. Thank you so much, everyone. This motion passes, and thank you for attending our special meeting.
Thank you.
Thank you so much, everyone. Bye-bye.
Bye.